What happens if my blood pressure cuff is too big? Have you ever wondered what could go wrong if your blood pressure cuff is too large? It might seem like a small detail, but it can have a big impact on your health. When using a blood pressure cuff that is too big, you may get inaccurate readings. Specifically, it can lead to an underestimation of your actual blood pressure levels. This means that the number you see could be lower than what it truly is. For those managing hypertension, this underestimation can be a significant issue. It might hide the seriousness of high blood pressure, which could delay the necessary treatment or adjustments in therapy. The size of the cuff bladder, which is the inflatable part of the cuff, must match the circumference of your upper arm. To measure this correctly, find the midpoint between your shoulder and elbow and measure around that area. If the cuff is too large, the bladder may not compress your artery properly. This can result in falsely low readings. Research indicates that using a cuff one size too large can underestimate systolic blood pressure by about 5 to 10 millimeters of mercury. If an extra-large cuff is used instead of the correct size, the underestimation can be even greater, sometimes reaching around 20 millimeters of mercury. This inaccuracy is especially important in hypertension management. Blood pressure readings are essential for guiding diagnosis and treatment decisions. An underestimated reading could lead to missing a diagnosis of hypertension or incorrectly assessing that blood pressure is under control when it is not. This situation increases the risk of complications such as heart disease, stroke, and kidney damage. To ensure accurate blood pressure measurement for managing hypertension, selecting the right cuff size is vital. The bladder length should cover about 75% of your arm circumference, while the width should be around 40%. Proper cuff sizing, along with correct patient positioning and measurement technique, helps provide reliable readings that reflected true blood pressure levels. In practical terms, if you or your healthcare provider use a blood pressure cuff that is too large, the reading may underestimate your blood pressure. This could lead to undertreatment of hypertension. Therefore, using the correct cuff size is a key step in accurate blood pressure monitoring and effective hypertension management.